Cytomegalovirus CMV. Cytomegalovirus is a member of herpes viridae family. Herpes. Herpine means to creep or spreading. This herpes viridae family consists of 9 different species. First one is the herpes simplex virus 1 and second one is the herpes simplex 2. These two viruses are responsible for orolabial herpes and genital herpes. And third one is the varicella zoster. Your varicella is responsible for chickenpox and zoster is responsible for cinclus. And fourth one is the Epstein-Barr virus, which causes infection including mononucleases. And next one is the cytomegalovirus, and this virus is we are going to see in this video. And sixth one is the human herpes 6A and human herpes 6B. These viruses are responsible for causing roseola infantum. And next one is the human herpes 7 and human herpes 8. These organisms are responsible for Kaposi sarcoma associated infections. And the last species in this family herpes viridae is herpes virus 9, which infects the human beings. And this cytomegalovirus CMV is the causative agent for cold sores. It is not a very serious problem if the human host's immune system is very good. It will not cause any serious problem. It will cause the infection in patients with weakened immune systems, like someone with advanced HIV or those who are undergoing any chemotherapy. And most often in persons with advanced HIV, and this cytomegalovirus causes eye infection called retinitis, which leads to blindness. And this CMV retinitis is an AIDS defining condition. This virus remains dormant in the body and cause complication during the pregnancy for the people with weakened immune system. This virus spreads through body fluids such as blood, saliva, urine, semen and breast milk, and it can also pass from the pregnant mother to her unborn baby through the placenta. And regarding the treatment, there is no cure for this virus. However, these medications can help to treat newborns and people with weak immune systems. Structure of virus. This virus is usually spherical in shape and the size is ranges from 200 to 300 nanometer, and it is an icosahedral virus. The genetic material is a linear double-stranded DNA molecule, so it is comes under DNA viruses. And this double-stranded linear DNA virus is enclosed in a protein coat called capsid, and this capsid is made up of monomeric unit called capsomeres. Based on the number of capsomeres and the number of capsid, the size of the virus will be. And this capsid and the genetic material together we call it as a nucleocapsid, and this nucleocapsid is covered by or enclosed in by a outer lipid bilayer called envelope. So this virus is an enveloped virus, and in classification it comes under enveloped virus and a double-stranded DNA virus. And in the surface of the envelope, it contains viral glycoproteins, and this envelope is followed by another portion called tegumen, which is a proteinaceous matrix. Okay. And the glycoproteins which present on the surface of the envelope are in various types. In this cytomegalovirus, the glycoproteins are glycoprotein B, that is GB, GH, GL, GM, GN and GO, and all these glycoproteins are involved in the cell attachment and penetration of this CMV virus into the host cell. The tegumen portion also contains two major types of proteins in addition to some other cellular and viral RNA. So one class of the protein which present in the tegumen serves as the structural role and is also involved in the integral in the assembly and disassembly of the virion during entry. So the virus, when it enters into the host cell, it should be disassembled into capsid and double stranded DNA, then only it can able to do its functions or the replication processes properly. So this disassembly processes will be taken by these protein molecules, and also after the synthesis of the structural components and the DNA, the virus should be assembled, and this assembly process is also controlled by this or managed by this proteins which are present in the tegumen. And another class of protein in tegumen which modulates the host cell response to infection. And the genome of this CMV is a monopartite genome, linear, double-stranded, and the size of the genome is about 200 kb. The genome contains terminal and internal reiterated sequences. The replication of CMV. So for each and every viruses, the first step in their life cycle is the attachment. That is, attachment of the viruses with that of the host cell surface. So here already we see that the envelope, the lipid bilayer which contains glycoprotein on the surface of the virus, which helps the virus to attach with that of the receptor proteins which are present on the surface of the host cell. After attachment of this virus, next step is entry of viruses into the host cell. So regarding this entry may happen either by fusion at the plasma membrane or by endocytosis. The entry of this virus into the host cell is still unclear. After the entry, the nucleocapsid will enter into the cell, and this nucleocapsid through the nucleopore, it enters into the nucleus of the host cell, where it releases the double stranded DNA. Once the double stranded DNA get released into the nucleus, it starts its replication processes. Initially, it transcribes the immediate allele genes to form the immediate allele proteins, which is responsible for the synthesis of the next level allele proteins, which is responsible for structural component synthesis. And these allele proteins also protects the virus against innate host immunity. And this transcription of allele viral mRNA by host polymerase II encoding proteins involved in replication of the viral DNA. As first round of circular DNA amplification is occurs by bidirectional replication, and the synthesis of the double stranded DNA or the replication of this double stranded DNA is occurs in concatenameric copies by rolling circle model of replication. Then this late mRNAs is transcribed and it codes for structural proteins. And after the formation of the structural proteins as well as the double stranded DNA replication, these viruses enters into the assembly stage. Here the double stranded DNA virus is get packed into the preformed viral capsid. After the packing of DNA into the viral capsid, this one goes out from the nucleus of the host cell through the nucleopore through the endoplasmic reticulum. From there it acquires some of the proteins on the surface of the virus, and through the cytoplasm by endocytosis process or exit process, it releases from the host cell. While on releasing from the host cell, it acquires the glycoprotein, surface glycoproteins from the host cell. So this is the picture which shows the replication of cytomegalo virus. On the left side, you can see the attachment and penetration of the virus. Here clearly you can see the attachment of the CMV virus with that of the host cell, Only the nuclear capsid along with the double-stranded DNA get entered into the host cell. After entering into the host cell, this nuclear capsid moves to the nucleus through the nuclear pore. Once it enters into the nucleus, the double-stranded DNA is get released. Then this DNA starts its own replication and starts its own synthesis of the structural proteins. Initially, it synthesizes the immediate early proteins, and then it synthesizes the early proteins, which are the structural proteins, and then it replicates the DNA, its own DNA, by rolling circle model of replication in concatameric forms. After the synthesis of replication as well as the synthesis of the capsid, it gets assembled and it moves from the nucleus to the cytoplasm through the nuclear pore, passing the endoplasmic reticulum, and then passing this Golgi complex and everything, it through the cell membrane, it passes out from the host cell. While it passing out to the host cell, while it releasing from the host cell, it acquires the envelope with glycoprotein, and a mature cytomegalovirus is released from the host cell. And route of transmission, first one is the intrauterine. Intrauterine infection is thought to follow maternal viremia and placental infection. That is, the infection is transferred to the fetus through the placenta and also through the maternal viremic condition. Next one is the intrauterine transmission can occur at any time during pregnancy. Perinatal transmission, the infection is acquired mainly through two sites. One is infected genital secretions or through the breast milk. Next one, postnatal, the infection is transferred through saliva, blood transfusion, sexual transmission or organ transplantation. Clinical features, first one is the congenital infection. The virus may be transferred from the mother to the infant through breast milk. In neonates, CMV is the commonest cause of congenital infection, and it affects about 0.3% to 1% of all live births. And 5 to 10% of congenitally infected infants have symptoms at birth. Fatal disease occurs only in 20% of these infects, and 90% of the infants or symptomatic survivors have sequelae, and up to 15% of the asymptomatic survivors have sequelae. The CMV is the second commonest cause of mental retardation after Down syndrome and causes more cases of congenital damage than rubella. So, there are some of the effects of congenital cytomegaloviral infection. They are as follows. One is the central nervous system abnormalities, which causes microencephaly, that means smaller head. Actually, the head will form in small size than the normal size. Then mental retardation, that all you know, immature mental growth. Then spasticity means the muscle tightens or stiffens condition. Then next one is the epilepsy, is the abnormal brain activity. And another condition is the periventricular calcification, that means the white matter of the brain get damaged. Then it also causes eye infections like choroidoretinitis and optic atrophy. Choroidoretinitis means the inflammation of the choroid and the retina. Then optic atrophy means death of retinal ganglion cell action. Also, it causes ear infections like sensorineural deafness, and also it causes infections in the liver, leads to hepatosplenomegaly and jaundice, which is due to hepatitis. Hepatosplenomegaly means enlargement of the liver and spleen. Then jaundice means infection or destruction of the liver cells, that is mainly due to hepatitis. Then the infection or the effects which caused in lung is pneumonitis, that is the lung, the inflammation is found in the lungs, and it also cause infection in heart. The condition is called myocarditis, that is the inflammation in myocardial membrane, and it also causes thrombocytopenic purpura. This is an immune disorder in which the blood does not clot normally. Then another condition is the hemolytic anemia. It is also a disorder in which RBC are destroyed faster. And another one effect is late sequelae, which damages the enamel forming organ of the teeth, resulting in yellow discoloration of the teeth and brittleness. This occurs in 40% of such infants. Then perinatal infection, it is the most condition which are found in the infants. It's a perinatally infected infants do not develop acute symptoms, although cases of infantile pneumonitis also reported. This appears to be an exceedingly rare event. Then postnatal infection, the incubation period of this condition is 4 to 8 weeks. Primary CMV infection in the postnatal period is usually mild or asymptomatic. Occasionally this primary infection is accompanied with a syndrome of infectious mononucleases with atypical lymphocytosis. Infectious mononucleases means it's a glandular fever. Then this is similar to syndrome produced by Epstein-Barr virus, except that lymphadenopathy is uncommon. And the post-perfusion syndrome is essentially CMV mononucleases acquired by blood transfusion. Sometimes the hepatitis picture predominates, so that a diagnosis of non-A, non-B hepatitis is made. In immunocompromised patients, it causes asymptomatic conditions. The conditions which was seen in immunocompromised patients are: the patients may develop a spiking pyrexia which resolves within few days. Some may develop a viremia with a septicemia like syndrome in the presence or absence of hepatitis. The next condition which occurs in immunocompromised patients is the pneumonitis, and next one is the virus disseminate to involve the retina, causing a CMV retinitis, leads to blindness. And it also disseminates to the gut region, and which causes ulceration or hemorrhage by the erosion of nearby blood vessels. It also induced immunosuppressive syndrome. The patient becomes unable to deal with opportunistic infections such as Pseudomonas. So in this instance, the underlying nature of CMV infection is not recognized by the clinical staff, who are naturally more concerned with the opportunistic infection. Renal transplant patients may also develop an interstitial glomerulonephritis following CMV infection. It has been described following primary and recurrent infection is associated with viremia and poor graft function and not to immune complexes. Allograft recipients typically have recurrent infection 2 to 3 months after the transplantation. On average, their viruria occurs 1 or 2 weeks later than that resulting from primary infection. AIDS patient may develop a low-grade encephalopathy and CMV adrenitis. In addition, Kaposi's sarcoma is associated with past CMV. Already we learned in the starting of this video, Kaposi's sarcoma, which is caused by the human herpes 8 virus. This infection is also associated with a past CMV infection. Patients with Kaposi's sarcoma are more likely to have CMV IgG antibodies and at higher titers than the controls. So CMV DNA sequences have been found in Kaposi's sarcoma tumors. However, a recently discovered agent, human herpes virus 8, is reported to have a much firmer association with Kaposi's sarcoma. Laboratory diagnosis. Laboratory tests including test of blood and other body fluids or test of tissue samples can detect the CMV viruses. and in pregnant women with antibodies have a very small chance of reactivation infecting their unborn child. If doctor detects a new CMV infection during pregnancy, a perinatal test should be done in order to check whether the fetus is infected or not. If the baby has congenital CMV, it is important to test the body within first 3 weeks of birth. So, after that test can't show baby has congenital CMV because the baby might have contracted the infection by nursing or exposure to other people with the virus. If baby has CMV, doctor likely will recommend additional tests to check the health of the baby's organs such as the liver and kidneys. Cell culture technique. Human embryo lung fibroblast are most commonly used cell line to culture this virus. The specimen is inoculated in these HCl cells and kept for 28 hours as a incubation period with a blind passage at 14 days. CMV produces a typical focal cytopathic effect in the HCl cells, which denotes the presence of CMV virus in the sample. Then histopathology. Cytomegalic inclusions can be recognized from biopsy materials by the typical owl's eye appearance. The samples are taken from the biopsies are taken from the infected organs like liver, lungs and spleen, and it is examined for a histopathological effect. So, if the organs are infected with the CMV, the cytomegalic inclusions will be found on the organs which can be absorbed by owl's eye appearance. Next one is the tissue immunofluorescence test. The infected lung and liver cells stained by specific anti-CMV antibodies. So, if the virus is present in these organs, these antibodies will bind with the antigens of the viruses, and when it is examined which shows the presence of viruses. Then electron microscopic study. Virions in the urine of congenitally infected infants may be visualized by electron microscopy in up to 80% of cases. Another test is the ELISA for CMV antigen in the urine. To check the CMV antigen in the urine, ELISA test is done, and also the detection of CMV double stranded DNA by PCR can also an effective method to diagnose the presence of CMV. And another one test is the CMV antigenemia test. This test is based upon the detection of PP65, a structural protein expressed on the surface of the infected polymorphonuclear lymphocytes. When the virus infects the host immune cells, the antigenic nature is expressed on the surface of the host cell. One of such protein expression is PP65, and by detecting this PP65 in the polymorphonuclear lymphocytes, we can conclude the presence of CMV virus in that particular person. Then treatment. There is no vaccine for this CMV virus and there is no cure. People with acquired CMV who are infected for the first time can use painkillers such as Tylenol, ibuprofen or aspirin to relieve symptoms, and they should drink plenty of fluids in order to get rid of these symptoms or to manage the symptoms. Patients with congenital or recurring CMV can use antiviral medications such as ganciclovir to slow down the spread of the virus inside the host body. These medications may have adverse effects. So, if there is extensive organ damage, hospitalization may be necessary. Newborns may need to stay in the hospital until their organ functions return to normal. Prevention. The mostly following prevention is wash the hands regularly with the soap and water, as we are doing nowadays to get rid of or to protect ourselves from corona infection. The same precautions or preventive measures should be followed for this CMV virus. Avoid kissing a young child, including tear and saliva contact. Avoid sharing glasses and kitchen utensils, for example passing round a drink Dispose of diapers, paper handkerchiefs and similar items should be done carefully, and use of condom to prevent the spread of CMV through vaginal fluids and semen. Thank you.